sort of for the purpose of making sure we have a quorum. So if you're on the Public Health Committee, please come about. Mr. Secretary, would you call the roll?
Bryan, Parker, Blackman, Blackwell, Blunt, Kaufman, DeBar, Fillingane, Frazier, Harkins, Hobson, Horn, Johnson, McMahon, Parks, Polk, Tate, Wiggins, Witherspoon. We have a quorum.
I understand there's a quorum present. Mr. Marshall, can you hear okay? Thank you. We always like to start the meeting with a mic check. I will say to the members of the committee, I promised you that after I had my shots, I would come back down and dwell amongst you, and so I've followed through on that. The first item on our agenda is the nomination of Dr. Ken Lippincott to the State Board of Medical Licensure. I've suggested to Dr. Lippincott that he might want to just come on over to the podium and visit with us. I think that somebody must be on a cell phone. I hear all manner of racket. From somewhere, okay. Dr. Lippincott, why don't you just tell us about yourself and what it's like being on the committee and on and on.
Thank you, Senator. I'm Dr. Ken Lippincott from Tupelo, and I've served on the Board of Medical Licensure since 2014, and the job of the licensure board is to license physicians and to protect the public, and we're charged with disciplining physicians who break the rules, and I've learned a lot about that. And we're also charged with providing regulations for the practice of medicine, and I've learned quite a bit about that, and I'd be glad to entertain any questions the committee might have.
Well, Dr. Lippincott, thanks for coming down. Over the years, going back in double digits, I don't know how many in my age, all the years run together, we've sort of had an ongoing dialogue with the Board of Medical Licensure. And there was a point more than a decade ago in which it seemed that the board was making it very difficult for physicians to come and practice in Mississippi. There were requirements about interviews and on and on. And I think that's much better. And I understand the board is doing some things to make it easier for doctors to get temporary licenses. I think there are two concerns that I have. One is that if a physician is going to be practicing in Mississippi, whether remotely by the internets or however they do it, who knows, telephone, teletype, telemedicine, all of that, that physician, that doctor, should be subject to discipline by the State Board of Medical Licensure in Mississippi for anything that occurs in Mississippi. And my understanding is that's resolved by having a Mississippi license. But at the same time, there's a concern to make sure that physicians that patients in Mississippi have access to physicians, and to the extent telehealth is appropriate, that's available. I know that there are situations which would lead one to believe that some of the people interested in telehealth are actually churning the system and trying to obtain excess compensation from insurance companies, Medicare, Medicaid, and other services. So this is all way too complicated for me to figure out. What are y'all going to do about all that?
Well, we have telemedicine regulations that require that for physicians who participate in that to have a presence in the state, so that we're able to discipline them if necessary, and that they that they follow the rules. Is that what your question pertained to?
Well, for example, if I live in Memphis and I wish to see patients in Mississippi by telehealth, or however we say it, in other words, someone comes to my office in Memphis, they're a patient, but then they go home to somewhere in the state and they wish to communicate through telehealth. Is that permissible? I mean, how does that work? Would the doctor in Memphis get a license in Mississippi but still be able to live in Memphis? What are the mechanics of all of that?
That's an excellent question. We're always in the process of trying to keep up with the technology, and I'm not exactly. I know that a physician has to have a Mississippi license to provide telehealth in Mississippi, and that a physician who supervises a nurse practitioner in Mississippi has to practice in Mississippi for 20 hours each month. But I'm not exactly sure about the exact regulation. I believe that a physician can practice telehealth in Mississippi if he has a Mississippi license. But it's difficult. We had a meeting this week, and we were just discussing the difficulty of policing physicians who are, in a faraway state. So I'm not exactly sure. I'd have to examine the regulations in more detail.
Well, I'm not sure I fully understand how things work. I think in this regard, I'm at a place, one of my law professors once described is knowing that my glib understanding is not quite complete, but I don't know in which way it's incomplete. But my sort of superficial understanding is that you have a license, and the method of disciplining someone is by the license. But I mention this because this is an ongoing matter of concern. I think the committee and all of us want residents of Mississippi to have access to medical services that are available, even if they're being delivered in a way that's different from what all of us have thought of. At the same time, we're concerned about the quality of medical services, and I think all know that constantly there are those who would, given an opportunity to, churn the system, and
yes,
we, of course, need to guard against that.
Yes, sir. If a physician was abusing the system or exhibiting non-professional conduct, we could certainly have him come to the board and address that problem.
Yes, it's a fine line to walk, and I have no ideas about exactly how to do it, but I just mentioned that as a concern. Are there other members of the committee have questions or comments? Senator Parker.
Thank you, Senator Bryan. I'll just kind of go into the point Senator Bryan is making a little bit more, just for I guess, perspective on your part or some feedback on that. I think Senator Bryan's point is that, we certainly want to make the best health care available to the people of Mississippi, but we also do not want a situation where perhaps someone is, kind of collecting licenses from around the country and is holding maybe 50 licenses or however many they want to hold, and then they are practicing medicine in a remote location for maybe a larger area than would be fair. So you mentioned we were talking about the Memphis issue. Has your board or have you given any consideration, because I'm a fan of a doctor-patient relationship being formed, and if you have formed that relationship and then there's communication between the patient and that doctor, whether that doctor is from Memphis or whether they're from Jackson, then I think telemedicine is a little bit easier and a little more safe in its application. But if there is no relationship at all and there is no accountability, I have found in my life that if you've never met someone and looked eye to eye and had a conversation with them, it's a whole lot easier to tell them no or to give them bad advice than when you have formed a connection that makes you care a little bit more. So I just want you to kind of give your perspective on how many different licenses from multiple states you think would be a fair number for someone to hold, and how the Board of Medical Licensure might look to make sure that the patients are being cared for with that application in mind.
Yes, sir. Yes, sir. When I was here back in 2014, the concern of the committee was the time and effort it took to get physicians licensed, and we've improved that tremendously since then. Once a physician gets his information in, it usually takes a week or two to get licensed now, and we now have the interstate compact where physicians in different parts of the country can apply for multiple state licenses at once, which is good. It depends on the specialty. The rule for telemedicine is that a physician is permitted to practice telemedicine if he can get the same information and the same relationship as he would as if the patient was physically present. And it varies from specialty to specialty. Like we have, in particular, radiologists who read computer screens. It's not uncommon for them to have licenses in 50 states, but a primary care physician, we have a guideline that the first visit needs to be, at least the very first visit needs to be face-to-face in person. It would be very difficult to have that quality of physician-patient relationship with a completely electronic relationship, physician-patient relationship. So it's different from specialty to, what type of care the physician is providing. Okay.
I'll share that this year we had a lot of discussion. We have a licensure review board for occupations, and we came to the conclusion on a bill we passed this year that we were going to encourage prompt licensure for someone who moves to the state of Mississippi, establishes residency, and is choosing to practice here. We've done that for a number of occupations. For some reason, we excluded the lawyers and we excluded the medical licensure board from those provisions. So it is your opinion that, you are perfectly fine with medical licensure board accepting someone who has a license in all 50 states to practice medicine in the state of Mississippi?
Well, like I said, it depends on the situation. Like a radiologist has to have a Mississippi license to read X-rays for patients in Mississippi, and it's not uncommon for them to have multiple licenses. But a primary care physician, no. I think they need to have a physical presence in the state.
Okay, thank you.
I would just say, Dr. Lippincott, listening to that exchange, I think it's made clear what I was stumbling around and trying to say. And there is, as you say, a major difference between your primary physician, who you would think you would spend a good deal of time, and if not all the time, in face-to-face communication with that person. Of course, not always, but that would sort of be the most likely thing. But then you look at your example of a radiologist. There's just someone sitting somewhere reading computer screens or images or whatever's produced, and that can easily be done remotely, and it can be done all over the place, and the interaction between that person and the patient in the ordinary course of things is limited, if it exists at all. And then between that, you would have the situation of a specialist somewhere looking at a particular person, and that might be a situation where there would be no personal interaction, but a specialist in another state could, through telemedicine, appropriately treat a patient in Mississippi. And we have to rely on the Board of Medical Licensures to know the difference and look at the situations and see what's going on. So that's what I was trying to say, however inartfully. Did someone else have a question? Senator Warren.
Thank you, Mr. Chairman. Excuse me. So, Doctor, can you tell us what your position is regarding the supervision of nurse practitioners by physicians?
Yes, sir. The rules of the medical board are that a physician collaborates with a nurse practitioner, and we have regulations for physicians that they're required to meet with the nurse practitioner and review a certain percentage of their charts. And our position is that just like the nursing board has regulations that require collaboration with a physician, and that's our position.
And are you in favor of retaining that collaboration?
Yes, sir.
Thank you, Mr. Chairman.
Anything else? Anyone else? Again, Dr. Lippincott, thank you for coming down here. The reason we ask you to come before the committee is this is an important nomination. And you've mentioned the concerns about the difficulty in getting licenses issued. And yes, there has been a fairly dramatic improvement over the years, and I think the committee's appreciative for that improvement. And so thanks for coming down. Is there a motion? There's a motion that we do advise and consent. Are you ready to vote? All in favor say aye. Aye. All opposed, no. The ayes appear to have it. The ayes have it. Well, Dr. Lippincott, you made it. Thank you.
Thank you for the privilege to serve.
You're free to stay and visit with us, or you're free to go back home and see patients, whichever you'd prefer. Thank you. Ms. Lippincott, thank you for coming down too. I'm now going to suggest that we take up the next three items in the on the agenda in a block. I'll give members time to look at the peer committee reports for those, and also to look at the peer committee report for the last item on the agenda.
Mr. Chairman, one question, if I could, on the appointment for the third one in the list, Ms. Lauren Michelle Hedgewood. There's a note that suggesting a slightly different alteration to the appointment date in the staff's conclusion. Are you aware of that? Is that something we are working on at this time?
It's my understanding that when some of the appointments came to the Senate, that they had a incorrect date of appointment, and those matters were resolved by having new nominations come forward with the proper date of appointment. And it's possible that the peer committee report refers to an earlier nomination for the same individual. But it's my understanding that all of that has been cleared up and that the nominations before us do have the correct dates. Of course, I have been misinformed before, as we have learned, but this is what I'm informed. Do members have any concerns about anything in the peer committee reports for any of these nominees? If they're not, I would entertain a motion to take up all of these items in block.
So moved.
Is there any, there's a motion to take up all the items in block. Is there any objection to that? Seeing none, there's a motion that we do advise and consent on all four of these. Questions, debate, you ready to vote?
All three of these?
Well, I was going to do all four of them unless there's some reason not
Oh,
to.
you mean the first four? Well, I thought we were setting item 48 aside.
Well, if you want to, we'll just do numbers 9, 28, and 41.
So moved.
All in favor, say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it. We'll report those. Senator Horn, do you have questions about the other nomination? Well, what I was going to suggest is this. If there are questions about that, we're going to meet again Sunday. So just let me explain it. In order to try to accommodate the people we're seeing, many of whom are doctors, and you know they have schedules and all, I've scheduled a meeting for Sunday afternoon so that we can accommodate their schedules. So we'll just take that other one up Sunday afternoon if that's okay. And I'm going to get a time that's convenient. I assume what will happen Sunday is, if I had to guess, is we would convene somewhere around 2, probably spend an hour or so on the floor. And so I may tell people to come at 4 for a committee meeting, but I think the nominations are important enough that we should have the individuals come down here. I'm trying to accommodate time and whatever passes for a schedule around here. So that's my intention. Having said that, unless there's something else, I'll entertain a motion to rise and report.
So moved.
All in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it, and we are adjourned.